Hello everyone! Today we explore an essential instrument in histology and cytology that plays a crucial role in microscopic diagnosis, the microtome. Before we begin, let me ask, how do we observe tissues under a microscope when they are naturally thick and opaque? The answer lies in cutting extremely thin sections of tissue. This ability allows light to pass through and reveal cellular detail otherwise invisible. A microtome is a specialized instrument designed to cut those extremely thin slices, called sections, so they can be examined under a microscope. The term microtome comes from Greek words meaning small and to cut, which reflects its precise function in preparing specimens for analysis. These sections are so thin that light transmits through them, revealing structure, pathology, and cellular relationships critical for diagnosis and research. Microtomes come in several types: rotary, sliding, cryostat, and ultramicrotomes, each suited to different materials and thickness ranges. The core components include the blade, specimen holder, knife holder, and an advanced mechanism that moves the block towards the blade. Rotary microtomes rotate the specimen block across a stationary blade for routine paraffin sections, offering consistency and speed. Cryostats perform sectioning at cold temperatures for frozen tissues, enabling rapid intraoperative diagnosis and quick pathology turnaround. Ultramicrotomes produce ultrastructural sections for electron microscopy, cutting slices measured in nanometers to study subcellular detail. Choosing the correct microtome type depends on sample hardness, desired thickness, speed, and downstream staining or imaging requirements. Proper preparation begins with fixation, embedding, and trimming the paraffin or resin block to expose the tissue surface evenly. Mount the block securely in the specimen holder and orient the tissue so the area of interest will be sectioned optimally. Set the desired section thickness, typically between 2 and 10 micrometers for light microscopy, depending on the application. Advance the block and make a series of knife strokes, producing a ribbon or individual sections that can be collected onto slides. Use simple labeled diagrams to show blade angle, block face trimming, and the sequence of cutting, floating, and mounting sections. Hydrate, stain, dehydrate, and cover slip the mounted sections to prepare them for microscopic examination and long-term storage. Thin histologic sections are foundational in clinical diagnosis, guiding treatment decisions in oncology, infectious disease, transplant pathology, and many other specialties. High-quality sectioning preserves cellular morphology and prevents artifacts like chatter, compression, or folding that could mislead pathologists. Safety is critical. Operators must wear cut-resistant gloves, eye protection, and follow blade handling protocols to avoid injury and contamination. Regular blade changes, proper disposal, and routine instrument maintenance ensure consistent performance and reduce the risk of specimen damage. Callouts highlighting clinical importance can emphasize turnaround time, diagnostic accuracy, and the impact of quality sections on patient outcomes. Consistent training, quality control checks, and supervisor reviews help maintain sectioning standards and improve diagnostic reliability. Common problems include wrinkled sections, thick or uneven cuts, or contamination. Each issue has specific corrective actions to restore quality. Adjust blade angle, cooling methods, trimming technique, and section thickness to address compression, chatter, or folding artifacts. For frozen sections, ensure rapid freezing, minimize ice crystal formation, and maintain cryostat cleanliness to preserve morphology. Document key parameters for each specimen: thickness, blade type, temperature, and cutting speed, so results are reproducible and issues traceable. In summary, the microtome turns solid tissue into diagnostic sections. Skill, equipment, and attention to detail make the difference. Thank you for watching. For laboratory protocols, troubleshooting guides, and further training, consult institutional guidelines and experienced histotechnologists. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.